this bill that's currently in front of the United States Senate, not the answer. It's simply not the answer. And I'm announcing today that in this form I will not support it. Our first vote on this piece of legislation may be as early as Tuesday. We'll have a procedural motion that we don't need to get into, but it's called getting on the bill so that we can have a final vote sometime on Friday. I'm just telling you this, if this is the bill, if this is the language of that procedural motion on Tuesday, I will be voting for it. So I've spent quite a bit of time from one side of the country to the other. I probably spend 50% of my time in Washington, D.C., 50% of my time somewhere here in the state of Nevada. Rarely it's at home, but I do make it home every once in a while to have these conversations. I've always said the same thing. I've always said the same thing. If you want my support, on legislation, on health care that fixes the state of Nevada, that supports these people that are on expanded Medicaid, you got to make sure that the Republican governors that have expanded this Medicaid sign off on it. I've been saying that for months, and some of you have quoted me on that. What does Governor Sandoval, what does he think? How does he feel about the changes that are occurring? And I think he shared with you a pretty good example of where he is today and where Nevada today is on Medicaid expansion. And I don't disagree with him. We have 200,000 Nevadans. We're talking those with mental health, with disabilities, mother with children, that today have insurance that they probably would not have had 5 years ago, 6 years ago. They have insurance today. The question is, what are the changes in here, and will that assure that these individuals will have insurance in the future? And I'm telling you right now, it doesn't do that.